coming back to why are we using these creams is because vitiligo is what is called as an autoimmune disease, which is where our body's own immunity is killing these melanocytes. So we are basically looking at modulating that immunity so that the killing of melanocytes is decreased. Is that how it works?
Yes.
Guys, welcome back for our second video on vitiligo. Today we'll be discussing with Dr. Girish Shah, who's still with us, about the different treatment options of vitiligo. These treatment options will depend on how your vitiligo is, how it is diagnosed. First, we'll talk about that, and then, as to what treatment options there are and how successful these treatments are as well. So let's get to it. First of all, how difficult is it to diagnose vitiligo, and are there any specific tests you need to do to diagnose vitiligo?
First of all, when patient comes with the white patches, it is not at all difficult for a dermatologist to differentiate vitiligo from other diseases presented with the white color. In 99% of the cases, the moment dermatologist looks at the patch and he knows that yes, this is vitiligo, this is not vitiligo. In case there is any confusion, then we have Wood's lamp. When we switch off other lights and see through the Wood's lamp, then if it is a case of vitiligo, it stands out very well. And it definitely helps in making 100% surety that yes, it is a case of vitiligo or it is not a case of vitiligo.
So, guys, Wood's lamp is basically like a light device. So it's UV light.
Yeah, it is UVC light.
It is a UVC light that is used by dermatologists to differentiate a lot of diseases from each other, and it's available with most of the dermats that are there. So yes, vitiligo is quite easy for dermatologists to diagnose, so you don't have to be scared as to what if they don't understand. Now, coming to the treatment of vitiligo, once a patient with vitiligo comes to you, how do you proceed with their treatments? What are the questions you ask of them? What do you want to know from them? Is there any specific advice that you give them in the first sitting of or the first consultation when you meet them?
Yes, when we talk about treatment of vitiligo, it is very important to understand that what is vitiligo, why we get these white patches. Now, our skin color is because of presence of pigment melanin in the skin. If there is less melanin, skin is on the fairer side. If there is a more melanin in the skin, it is on the darker side. And this melanin basically protects us from the effect of the sun. Now, whenever there is a loss of this melanin, because there are units in the skin known as melanocytes that produce this melanin pigment. And anything that damages these melanocytes, melanin producing units, then there is a loss of production of melanin and skin loses its color and it turns white, and that is vitiligo. Second important point, that this vitiligo is having different manners of presentation. In some individuals, it will present as few patches of vitiligo in 1 or 2 or 3 parts of the body, and it remains localized to their local areas. This is known as focal vitiligo. Then we have another class where vitiligo affects one segment of the body. Say for example, arms, only one arm or only one leg, or only it is in a linear way on the trunk or one side of the face. Now, this is known as segmental vitiligo. This is also known as zoster-form vitiligo because it runs like that of a herpes zoster, what is known as Nagin. Then we have what is known as acrofacial vitiligo. Here, white patches appears mainly on the hands, feet, lips, nose or ears. So, at the acral parts of the body.
So, acral means the endings, the ends parts, the terminal parts of your body, like the fingers and toes and nose and ears, that way. Yes.
And then fourth part, which is very, very common, and it is known as vitiligo vulgaris. When we say vulgaris, it means common. Now here, the vitiligo patches, they start appearing on both the sides of the body symmetrically. It can start from any part of the body, either face or arms or legs or trunk or back, and then slowly it spreads to other areas of the body. It is important to note that in some individuals, vitiligo can spread very fast and within a month it can cover large areas of the body. But in majority of the people, vitiligo starts on some areas and it slowly spreads over the other parts of the body. Now considering what is the type of vitiligo person is suffering with. Now especially focal vitiligo or segmental vitiligo. Here treatment is little easier.
Right.
Treatment can be given in the form of medical line of treatment and we can expect some good results. And in case they are not responding, even we can think of getting some surgical treatment. But when they suffer with the acrofacial or they suffer with the vitiligo vulgaris, it is covering large parts of the body. It can continue to spread. And here it requires little aggressive treatment. Treatment should be started as early possible. And then we have many medicines, many medical equipments to treat these patches, or even we have some surgical treatments for this.
Yes, so we'll get to those things in just a bit. Understanding this, there are two types of basic, summarizing the two basic broad types. One is one that does not spread extensively, and one is that starts spreading extensively. Now, when a person presents to you with something where the it's not very extensive, what is the medical line of treatment? By medical line of treatment, we mean medicines to that the patients can take orally. What are the medicines like? How do they sort of work, and how long will they work? How quickly they'll show results, and how many percentage of patients, when it is a limited disease, will get completely treated by these medicines only without any other ancillary treatments? Or do you require other ancillary treatments even for faster recovery or for more thorough recovery with these things? And we're just talking about the localized versions of vitiligo.
Now see, for vitiligo, there are set guidelines for the treatment. For example, if person is having very few patches of vitiligo, there are only 3-4 patches of vitiligo, then it is to be treated with only topical treatments, that is applications of the creams on the skin. It may be steroid containing creams or it may be non-steroidal creams like what we say immune modulating creams, that is tacrolimus or pimecrolimus, that kind of creams.
Coming back to why are we using these creams is because vitiligo is what is called as an autoimmune disease, which is where our body's own immunity is killing these melanocytes. So we are basically looking at modulating that immunity so that the killing of melanocytes is decreased. Is that how it works?
Yes, that is how it works.
So basically that is why steroids are a very good medicine to decrease one's hyperimmunity, if you will call this, and so are the immunomodulators. So that is why these immunomodulators or steroid creams or steroid medicines are used. So are there these oral medicines or are only creams available regarding with these medications?
Means as far as local patches are concerned, or when only small area of a body is concerned, then we usually prefer to start the treatment with topical treatments or topical line of treatments.
So topical means creams,
local external applications of creams. And another thing that we would prefer to do is to give them ultraviolet light. Now ultraviolet light is very, very important in the management of vitiligo. When there are few patches of vitiligo, we prefer to give them what is known as laser light, or it is excimer light or excimer laser. These are very, very effective in not only suppressing the disease but also in getting the skin color back. Now, oral medications are used only and only if, despite the use of these topical treatments and ultraviolet lights, patient is developing enlargement of the patches, patient is developing new patches, then we would definitely prefer to introduce oral medications to contain the spread of the disease, to contain the activity of the disease.
And now for a patient who comes with a widespread disease or spreading disease, for them, is the treatment going to be similar?
Now, when basic principle of the treatment in widespread disease of vitiligo vulgaris, even if it is not widespread, but if it is involving, for example, more than 10% of the body surface area, then first aim is to prevent further spread of the disease, control the activity of the disease, prevent further damage to the melanocytes. And this is where we give them orally either steroids or what we call this as immunosuppressors. Now, steroids are very effective, but it should not be given for more than 3 months because it has its own side effects. Or we use what is known as immunosuppressives. There are many immunosuppressives which are available, and these immunosuppressives are relatively more safe and they have less side effects as compared to steroids. Usually, we give oral medications for a period of 3 to 6 months, and once we find that the disease is stable, that is, its patches are not increasing in size or it is not spreading further, we would like to stop the oral medications. Here again, we would prefer to give them UV lights. Here, what we will prefer is UV lights, what is known as full body chamber or half body chamber, where person can undress himself, stand in the chamber for a given period of time, exposed to the UV lights, and come out. It helps not only in repigmentation of the patches, but also helps in preventing spread of the disease by causing immunosuppression.
Okay. So this is something that is very important. The full body chamber and half body lights are not available everywhere. We have them here at Skinzone. Dr. Girish Shah has had them since a long time, about 20 years now. 20, 25 years?
I have these UV lights with me since 1993.
So that's quite a long time, and we have a good number of patients from other dermatologists coming in for these UV lights as well. So that is good to know. Now, coming to the surgical part of this, which patients or not which patients, what are the surgeries? We'll come to the surgical, which patients and everything in the next video. What are the surgeries just that can be done for a vitiligo and how effective are they?
Now, there are various surgical modalities available for the management of vitiligo. It may be in the form of skin grafts, it may be blister skin graft or spin skin grafts, or even we do the punch grafts or mini punch grafts. Then we have what is known as cellular grafting, that is melanocyte transfer technique, or where we obtain the melanocytes either from epidermis or from the hair follicles, and these are very useful and very effective treatments.
Okay. So I guess that covers a large amount of what you need to know, the basics about what vitiligo treatment is. So there are medicines, there are UV lights, there is a laser sort of a light that is even more effective than a UV light, especially for smaller areas, called as excimer light. There is something called as full body and half body chamber that are again very important for widespread vitiligo that we have. We have all of these treatments done here at Skinzone. One other thing is the surgeries for vitiligo. We'll talk more about these in detail as to who are the right candidates for the surgery, which surgery is done at what period in time during the process of your disease, and how successful are they. So don't forget to join us for the third part of this video.